appreciate that, Deidre. I think as healthcare providers, we have an obligation to help patients when they're in need. And it's not abandonment, but I feel I need to do my part to help patients in need. I think that they get an obligation. We took an oath to help patients, and I want to be available to be able to uphold that oath.
Are you worried about your own health, though? Because, I mean, by all accounts, this virus is so contagious. So how are you protecting yourself? And I assume that your team is still with you in your office.
So we do a few things. First, plastic surgeons or surgeons in general, we're very used to sterile technique. And sterile technique is something that my office, my ambulatory surgery centers, as well as the rest of the staff upholds all the time, regardless of whether or not COVID-19 is going on. So because of that, we're already keeping that standard, and we're going to keep that even to the next level to be able to protect ourselves and, of course, other patients coming in.
So do you anticipate then having the kind of patient who has already been treated at a hospital, who is well enough, let's just say in the worst case scenario, or not quite the worst, almost the worst case scenario, to leave, for example, a ventilator, but needs some place to recoup? Is that the idea of the kind of part in the chain that you want to serve?
So the idea is, initially, I would like to be able to take care of the patients that are symptom-free, not necessarily COVID positive or negative, but at the same time symptom-free, that we can provide non-COVID emergency care for. That would be lacerations, that would be infections, that would be anything in the form of a surgical, which is what I can do for those patients, to be able to do that for them. So that's one opportunity. The other opportunity is providing some of the supplies that we're not using in terms of our anesthesia machines, our supplies, our monitors that are not being used in terms of being overwhelmed, and providing that and making it available for hospitals.
So, Dr. Tehrani, let me ask you, I mean, do you have testing kits? Because I know this has been something that's been difficult for a lot of you. I know tons of people who would love to be tested, and if their symptoms, they're told that if their symptoms are not bad enough, that they just can't be. Is that what you're finding as a provider?
Absolutely. We've applied very early on to get testing kits. We don't have them. They're only allowing hospitals to have them right now. So even if somebody wanted it, we could not do the test. Even if we had it, we're supposed to not do them unless the hospital is having it done inpatient. So these are for inpatient use only at the present time. So this is not about testing. This is about symptom or symptom-free and keeping those patients as
at their optimum health,
if possible, and treat their non-COVID emergencies like lacerations and things along the lines of that.
Yeah, no, that sounds amazing. So basically, you're taking care of everything so that those people don't go to their regular doctors or the hospitals and just add to the burden that they're dealing with.
Or urgent care, and the other is people are going to urgent care and they're sitting with other patients that could be symptomatic and exposing that.
That's always the question, right? When you're a patient and you're like, do I go and then do I get more sick or get something that I wouldn't ordinarily have? Dr. Tehrani, thank you. Seriously, thank you for the time and thank you for what you're doing. We appreciate it.
Thank you.
Speaking of medicine, India, one of the world's largest manufacturers of a malaria drug that is being touted as a possible coronavirus treatment. India says it will no longer export the drug after it fulfills